You go first.
Larry Horowitz, I'm Chief Staff Officer of a Michigan organization which includes most of our private sector labor unions and a wide array of businesses. 2 points. Economic, and one of them a request from Ms. Barnes. Economic. The reason Michigan is in such a difficult shape on health care coverage is because we invented the private sector system. It is the auto industry in World War II that first developed the system of having health care benefits to workers. It was a fantastic accomplishment of Walter Reuther and other people. The 48 plan was the first collective bargaining plan of size that provided health care benefits. It's an accident of the tax rules during World War II. Just because Michigan led the way in having employer-based coverage, Michigan shouldn't be punished for the outcome. Why? We've got those legacy costs.
Preach it, man. Preach it.
So that if there's one thing we could do to revive our auto industry is if you can make the healthcare legacy costs for the auto industries disappear, they could go forward and take it on the ongoing one. Then, number 2, specific nerdy suggestion to you. While you're developing the massive national health care reform, there are 2 federal agencies that are under the direct control of the President which could make a big major step. This is picking up on something from Carl DeLaw. The Food and Drug Administration, created by that left-wing socialist President Roosevelt, but the Republican one, Teddy, right? Created 100 years ago an agency that said, you can't sell your stuff in this country unless it's safe and does the job. It was been taken over by the people who are regulated, put it back under the control of the people. Don't have the regulated be funding the agency, have the people who are funded, and let's have the Food and Drug Administration make 2 decisions. Not only if it's safe, but are those things really going to do the job? Because we're spending so much money on newfound, incredible, expensive prescriptions and drugs and equipment. But then secondly and lastly, the Medicare system, CMS, pays 1 out of every $6 in health care in the United States of America. It's not taken over the private health care system. It's your money. You should be running it efficiently. Medicare doesn't do a very good job currently in establishing the prices, whether they're going to cover some drug or procedure or new equipment, nor how much they pay. It's parceled out to the 24 or 30 different administrators around the country. You could do that yourself without a need for a new authorization from Congress, and Congressman Dingell can tell you all about where the bodies are buried inside CMS and FDA. Thank you.
All right.